The world of long-term care is changing in 2018, and this will have impacts on the future of care in Central New York, as well as the future of Loretto. The number of Americans 65 and older living with memory loss, including Alzheimer's and other dementia conditions, is projected to more than triple from 5.1 million in 2016 to 16 million in 2050. Close to 18% of that growth will be right here in New York State. As the fourth largest healthcare provider in Central New York, with multiple facilities and programs dedicated to dementia care, Loretto is well positioned to lead the region in memory care. The Heritage, which is a Loretto community dedicated exclusively to those with Alzheimer's and dementia, was the first of its kind in Central New York, and it stays closely connected with the latest research related to memory care, making continued improvements to better serve its residents and to ensure high-quality care. To help address concerns over rising healthcare costs and to best leverage new technology, Loretto will be working to improve patient care and reduce readmissions rates through the incorporation of telemedicine to enhance our rehabilitation services. This year, Loretto will be introducing a new restorative care unit. It's the first of its kind in Central New York, and this unit will incorporate telemetry monitoring to track multiple health risks in real time and to allow our residents to access physicians any time of the day or night. These technologies, combined with our skilled nursing staff and a remote medical team, empower Loretto to provide much-needed care while decreasing hospital readmission rates and the associated costs in Central New York. There continues to be a shortage of skilled nursing and other professional staff that are needed nationally and in this region. As the sixth largest employer in Central New York, Loretto can and does make a big impact on the jobs in this area. Recruiting, training, employing, and supporting these individuals is a key area of focus for Loretto in 2018. We've recently hired more than 300 graduates of Center State CEO's Health Train program with an incredible 89% retention rate, much higher than the industry standard of 50 to 60%. But we must look closely at the unique needs of our diverse workforce in the long-term care industry in order to help them be successful in their jobs and to help Loretto remain a competitive employer that retains a strong workforce. None of our staff pays more than 10% of the premiums for their health care, and we've recently added an on-site urgent care center to ensure accessible health care free of charge. Our We Care grant program helps employees with unplanned hardships, and our unique partnership with ACMG Credit Union provides specific services to help employees purchase cars for transportation to and from work. We also participate with CNY Diaper Bank for our employees, providing free diapers to new families, and we invest in employees' growth by offering significant tuition support, up to 90% of the cost, to advance their education. As an employer, we believe that we have the power to change the future of our community, and we are committed to doing our part to make that happen through our workforce development initiatives in 2018. Tax reform is just one of the critical pieces of legislation that affects the services and the programs that we provide to individuals of all ages and income levels in Central New York. Residential facilities, like several of Loretto's facilities, account for 42% of all Medicaid spending, so any changes there would have a significantly negative impact on our people. And the number of people that we're serving, as well as the number of years for which we serve them, is also growing. Residents coming into our facilities are now living with us for 10, even 20 years, which was not the model when Medicaid was introduced in the 1960s. Even those people who might have saved for retirement and care in later years likely didn't anticipate living to 90 or 100 and at some point will need Medicaid assistance. 2018 is going to be a challenging year. We're likely to have fewer resources and an increased demand for complex medical and behavioral care services. We will need to be creative in anticipating the needs of our community, particularly for home and community-based services and specialty care services. We at Loretto will continue to address these and other issues as we seek to shape the future of healthcare in Central New York.